The latest research into early onset cancers, those diagnosed in people under 50, presents a troubling shift in public health, drawing on over 2 million patient cases and published in Cancer Discovery. The study reveals that certain cancer types are increasing at an alarming rate among younger adults. Breast, colorectal, kidney, and uterine cancers stand out, with their incidence rising by a staggering 80% between 2010 and 2019. This increase is not a minor statistical blip. It marks a dramatic and consistent trend that experts are still struggling to fully understand, let alone reverse. Most concerning is that this spike has occurred in parallel with similar patterns across the globe, suggesting systemic drivers that extend beyond genetics or chance. The study's authors warn that these rising cancer rates do not appear to be limited to any single lifestyle or genetic profile. However, certain groups are clearly more vulnerable. About 63% of the early onset cancers documented in the study were in women, indicating a gender disparity in both risk and impact. The reasons behind this are multifactorial, but no less troubling. Shifting reproductive patterns, including the trend toward later childbirth, have long been associated with higher breast cancer risk. Uterine cancer, too, has strong links to hormonal and metabolic factors, which are often influenced by weight, diet, and reproductive history. But even beyond these risk factors, the uptick signals deeper issues in the way modern society is affecting biological health much earlier in life. Obesity has emerged as one of the most consistently associated risk factors across several of the cancers on the rise. The modern lifestyle, with its combination of high-calorie diets, excessive sedentary behavior, and chronic stress, has been gradually creating the perfect conditions for metabolic dysfunction. Unlike slow-moving trends of the past, the metabolic toll of this lifestyle is now manifesting far earlier in the form of cancer. Young adults today face exposure to environmental, dietary, and hormonal disruptors from early childhood onward, and the effects are becoming starkly visible. These are not just cases of bad luck or family history. They are signals that something fundamental in our environment or behavior has changed. A 2023 global study echoed these concerns, showing a 79% rise in early-onset cancer cases worldwide over a span of nearly 3 decades. The accompanying 27.7% increase in cancer-related deaths during that period underscores the severity of the issue. The cancers with the highest mortality, breast, bowel, lung, trachea, and stomach, are not simply rising in frequency. They are killing more young people, despite all the medical advances of recent years. And perhaps most sobering is that North America leads much of this surge. Western dietary habits, particularly those involving high salt intake, red meat, alcohol, and ultra-processed foods, are repeatedly cited as major contributors. Layered on top of this is the widespread lack of physical activity, creating a convergence of risk factors that collectively accelerate cancer formation. What is especially disconcerting is that while some of the increase may be attributed to better detection, this does not fully account for the steep and consistent rise across multiple cancer types. The scientific community is grappling with the fact that even with improvements in diagnostics, the number of young people being diagnosed with cancer is outpacing what detection improvements alone would explain. Early detection may help improve outcomes, but it does not address the root causes driving the rise. Nor does it help those whose cancer is discovered only after it has advanced, which remains a major issue in populations that lack equitable access to healthcare or who are misdiagnosed due to their age. Even more frustrating is that the large-scale datasets used in these studies lack critical context, such as patients' lifestyle habits, environmental exposures, or socioeconomic status. Without these variables, researchers are left with correlations but few definitive answers. What they do know is that early-onset cancers now pose a public health concern that could reverse progress made in recent decades. Already, screening guidelines are being re-evaluated. Recommendations for colorectal cancer screening have been lowered to age 45, and more may follow. But this is reactive, not preventive, and without deeper intervention, we risk turning screening into a last line of defense rather than the first. There are also disturbing signals that this surge is being underestimated in some populations. As always, socioeconomic disparities mean that marginalized communities face greater risks and worse outcomes. Poor access to healthcare, underinsurance, dietary instability, and environmental toxin exposure all combine to increase vulnerability. If the cancer spike is due in part to preventable environmental or lifestyle factors, then failing to address these inequities means consigning many to avoidable suffering. Even testicular cancer, historically seen as one of the more treatable forms when caught early, has seen a rise in deaths in younger men. This suggests that the healthcare system may be failing to catch these cancers early enough, or that the biology of the disease is changing in ways we don't yet understand. Either way, the increase in cancer mortality among younger adults from multiple types of cancer demands attention, not just from doctors and scientists, but from policymakers and communities. These are not just numbers. They represent a growing number of young people whose lives are being disrupted or cut short. This troubling picture of early-onset cancer is not a mystery waiting to be solved years from now. It is an alarm bell demanding immediate and sustained attention. We are not facing a rare disease or isolated trend, but a shift in the foundational landscape of human health, shaped by the modern environment, economy, and lifestyle. To ignore it or soften the urgency would be to risk far more lives in the years ahead. If the current direction holds, we may be looking at a generation that faces higher cancer risk earlier in life than any before it, and one that will live with its consequences for decades.